future doctors of America. These are very important people to us. They give up 8, 10, 12 years of their lives studying to become doctors, studying to be able to help people. We are so happy that these young people are here today because they want to make sure they have a system to practice in where they can deliver the care that they know people need and that they want to give. I'm very proud to introduce Ermina Hack and excuse me, we have a little change to make. Here we have Ilona at Shalom instead of Chad Vogler. I think the difference would have been apparent when they got up here. So
Jefferson.
They're from Jefferson School of Medicine. So warm welcome.
Hello everyone, thank you all for being here today. As you were introduced, my name is Ermina Hawk and this is Yona at Shalom, and we're here from Jefferson Medical College and Jefferson School of Nursing. And we're here mainly because we have a healthcare crisis in this country. 47 million people are uninsured and close to 18,000 people die every year because they don't have healthcare insurance. This is a tragedy, this is a travesty, and it should not be happening in our country. Absolutely, absolutely. And as a medical student, I support universal health care because, one, as a future physician, this healthcare system is going to negatively impact, the system as is going to negatively impact the way that I practice. Yes. You know, I believe that healthcare is a human right, and that my patients should have access to that basic human right. You know, the right to be healthy, the right to be free of illness, the right to have access to a doctor. And as a med student, I feel that, you know, this is necessary. I also feel that the lack of universal health care leads to a lack of primary care physicians, which we need in this country, and that we have a severe shortage of, as you all know. So that's another good reason. Also, you know, as a person, not just as a physician, I recently, both of my parents lost their jobs, and I'm going to be uninsured in a matter of weeks. So, just as a citizen, I support the system because I need healthcare too, you know, not just as a med student. So, it's personal as well as political. And basically, I believe that everyone should be in and nobody should be out. We all need to be part of the system, we all need to pay into it, and I believe this is going to be good for us all. Thank you.
I'm Yona at Shalom. As Ermina said, I'm from the Jefferson School of Nursing. I just graduated this week. And I'm very excited to enter the profession of nursing. And I do it with a lot of nervousness because we have, as Ermina and as Dr. Tsu mentioned, we have a healthcare crisis in Philadelphia and nationally. And I know a lot of people, including some healthcare professionals, are concerned that we have to choose between taking care of everyone in this country, everyone, not just everyone who is a citizen, but everyone who lives here, everyone who is on this soil. And between that and between taking care of our economy and saving our corporations and making sure that financially we are afloat. But we don't have to choose. I know a lot of people are scared about that, but we don't have to choose because single payer does save us money. Single payer saves hospitals money, and I'm sure a lot of you know that Temple's Northeastern Hospital closed recently, or is in the process of closing. Hospitals are closing because of financial reasons. And a lot of hospitals are suffering because, indirectly or directly, because there isn't enough preventative care. If people had health care, if everyone was covered, people could seek out preventative care and get checkups on a regular basis and not have the healthcare crisis that they have. People could use emergency rooms for emergencies and not as their main healthcare provider because that's the only way they can get affordable care. Hospitals need single payer in order to survive so that we can use emergency rooms as they were intended to be used so that I can have a fabulous experience when I'm an emergency room nurse. and take care of people who are in crisis and who need that kind of time and that kind of resources. And so that Armina, when she's a primary care healthcare provider, she can work with people from all kinds of financial backgrounds, people who previously could not afford a basic checkup. This is crucial. This is crucial for our hospitals, for our economy, for our healthcare providers, knowing that we're going into a field that is sustainable, that we can work in and take care of all the people who need to be taken care of, not just the people who can currently afford that. The main message that we want to leave you with is that we need to value patients over profits.
Absolutely.
This company and every health insurance company, they're scared that, well, let's just say that they're scared that insuring everyone would mean that people with lots of money would lose their lots of money, and that that's more important than making sure that every single person has the basic human right of healthcare.
Yes.
But we don't need to put profits before patients. We can't. Morally, we can't. So patients over profits. Patients over profits.
Patients over profits. Patients over profits. Patients over profits. Patients over profits. Patients over profits.
Thank you very much.
Thank you very much. I didn't mean to shortchange nurses. I'm a nurse myself. Welcome to the profession. You can have a great coronary bypass surgery, but if you don't have good nurses taking care of you afterwards, you might as well not have bothered. Our next speaker is Chuck Pinocchio. He's the Executive Director of Healthcare for all Pennsylvania.
Jamana be na